So what you're saying is your database that you've spent your whole career on data. But what we witnessed throughout the pandemic was people who were typically supposed to be data based. I mean, that just went out the window, and suddenly they were manipulating the
Yeah, I
science
mean,
even.
it's not so much that they didn't that no one had the statistical methods or the understanding of numbers and so on. It's not so much that, it's more that there is an incredible degree of bias. There's an incredible degree of aligning yourself with your employer and the people who give you grants and so on, and you lose your critical faculties when you're just concerned about your career and where your next grant is coming from. Even high level scientists tend to lose their faculties. So that's really been the main problem. I don't have that problem because I'm not, I'm retired. I'm not tied to any institution at the moment. I've got just my skills and my desire to figure out what is going on, what the truth is. That's all that motivates me, and so I can do this kind of work and at the highest level. So what I first decided to do right away when we heard about this terrible virulent pathogen that had come down onto the planet was to see if we could actually see deaths, because what you have to realize is that the world, the countries, the nations, we have an incredible system to monitor mortality. We all tabulate and register all cause mortality, which means every jurisdiction counts their dead. We count deaths. We know when people die, how old they were, where they died, and we register this very faithfully. So it's not like trying to assign the cause of death, which is can be a political exercise, and there is a lot of bias involved even among clinicians when you try to do that. We forget about that. Let's just count the deaths. And when you count the deaths, you're sure of the numbers, and you can do it as a function of time. So you're counting the deaths by day or by week or by month, so you can actually see how they're progressing in time, and you know a specific jurisdiction, and you can know a specific age group as well. So this means that anything that happens in society that causes a change in the mortality, a sudden increase in mortality, will be registered by this system, and you'll know where it happens. So all cause mortality allows you to see such phenomena as earthquakes, heat waves, wars, economic depressions, all of these kinds of stresses in society, newfound stresses like a collapse of the economy. All of these things show up in all cause mortality. And since you know it by age, you can tell the kind of phenomenon it is as well. Because, for example, when an earthquake crushes a bunch of people in buildings, it's indiscriminate of age. It's whoever happens to be in that building. But when other causes which are more, let's say, related to toxicity or things like that, elderly people will suffer more. A heat wave tends to kill elderly people much more. So it's a very powerful tool. It's been used for more than 100 years. This is the basis of fundamental epidemiology. This is how epidemiology as a science was created, was through those numbers. And this is what you can do. And it remains the most powerful way to be sure about changes in mortality. So I went straight to that data and tried to see, well, okay, is it true? Are there people dying? And what I found is I was looking at all of the provinces in Canada and all of the states in the US at first, that my first papers were about that. And what I found was that at the very beginning, when the pandemic was announced, there was a huge surge in mortality immediately when this political event of the announcement of a pandemic occurred, but only in very specific hotspots. So, like New York City, Vermont State, New York State, Northern Italy, Paris, Madrid, Copenhagen. These places were hotspots, places that had large hospitals where they were treating people with new protocols very aggressively. All of a sudden, because the World Health Organization had announced that now there was going to be people coming into the hospital with this new disease, and you had to treat them, and we don't know how to treat them, and so on and so on. So there were very aggressive treatment protocols that were applied at the beginning that were murderous, basically, and that caused these spikes. Now, I recognized immediately that these spikes were inconsistent. They disproved the idea of a spreading viral respiratory disease because they were synchronous with the announcement of the pandemic. And you cannot have synchronous peaks in mortality around the world in several different continents, all happening at the same time, that come from the spreading viral respiratory disease or a spreading respiratory disease of any kind, or anything that spreads by contact, cannot simultaneously occur very suddenly all around the world like that. It just doesn't. And in particular, viral respiratory diseases, epidemiological theory tells you that the time between seeding of the disease, the new pathogen that's presupposed, and when the mortality excess will be visible, large enough to be visible, that time lag is extremely sensitive to the culture and to the nation and to the structures and to the habits of people and so on. And so many calculations have shown that that lag in time will vary by months and even years from place to place. So it was impossible that these peaks, these synchronous peaks, could be due to this kind of phenomenon. So our first paper was written in June of 2020, and where we argued that these spikes cannot be due to this, and they must be due to the horrendous things that we know you're doing to elderly people in care homes and in hospitals. And so that was our first paper where we announced that something was off. Um, now,
Can I interrupt you just
also,
real quickly there?
sure.
What were the treatment protocols that shifted? I mean, we see in the winter, of course, pneumonia, for example. Pneumonia
Oh,
circulates
well,
around, that kills
there was
people.
there was an aggressive use of mechanical ventilators that had never been used to this degree before for respiratory problems. I mean, in northern Italy, they even decided that they could put two patients on one mechanical respirator in order to put everybody on as much as they could. New York is really known as a hotspot where the emergency care units did this and they overdid it. And there have been scientific articles that have confirmed this, that it was a deadly treatment. There were other deadly treatments, and they were not the deadly treatments were not the same everywhere, but the hotspot was when they applied them. So you had a very quick response in terms of deaths. For example, in France, they used very aggressively used at the beginning. Some hotspots in Europe, they were using HCQ, but at doses that are toxic. So very high doses of hydroxychloroquine that were toxic, and this was the result of some first reports that said it could be very beneficial. Based on laboratory in vitro experiments, they found that it could be very beneficial. And I'm sure it can be in controlled clinical settings once you know what you're doing. But at the very beginning, many groups, many hospital were using it excessively. So you can see the data of the prescription use, the use by hospitals of this drug, and it just shoots up exactly when you have this peak in mortality. And there are several drugs like that were used. There were drugs that sedate elderly people and so on that were overly used. So at the very beginning, we find correlations to those kinds of very rapid and new treatment protocols that were applied.
Yeah. Were there areas that had massive spikes of the virus, the same as, let's say, Northern Italy or New York, but who did not use any of those treatment protocols, but stuck with the tried and true of how you deal with a respiratory illness? And did
Well,
they see a
that's
different
interesting that
outcome?
you asked. Yeah. Okay. So that spike, that initial spike, you caused it due to the virus. You understand? I'm arguing it's not due to a virus at all. It's due to what was the measures that were applied. That's what killed people.